Alright guys, so we'll be starting a new lecture schedule on our YouTube channel today, and this is basically the pathology of schistosomiasis. Alright, and I'm just here to give you guys a course outline for the pathology of schistosomiasis. Okay, so that you guys know that from here we have videos on this, and this coming in. Okay, so this is the course outline for pathology of schistosomiasis, and I've already arranged all the materials for making videos, and they are like 33 in number. Okay, so we'll be talking about the schistosomiasis, talking about the different examples of organisms under the schistosoma worms. We're talking about the effects of the schistosomiasis on different organs like the kidney, the urinary system of effects of schistosomiasis on organs and kidneys too, organs and systems too, sorry. Okay, so under the systems, we're talking about the genitourinary system, we're talking about the gastrointestinal system, we're talking about the reproductive system, we're talking about the respiratory system. Under organs, talking about kidney, liver, spleen, and the heart and all that. Okay, so this picture right here just shows an overview of the life cycle of the schistosoma worm. Okay, the pathology of the schistosoma hematobium, the pathology includes what? Hematuria, scarring, calcification, and squamous cell carcinoma. And occasionally, you could have an embolic egg granulomas in what? Brains and spinal cord. Right? So schistosomiasis, also known as what? Bilharzia, is a disease caused by what? Parasitic worms. Alright? Although the worms that cause schistosomiasis are not found in USA, alright? I know that most disease conditions they use the USA as a bar to actually measure them. Do you understand? So the worms that cause this schistosomiasis are not found in the USA, but people are infected with this disease worldwide. Now, in terms of impact of this disease, is second only to malaria as the most devastating parasitic disease. All right, so talking about the course outline, I'll be having an introduction. That's video I'll be making. After this, we'll be talking about the definition of what schistosomiasis is. We're talking about the epidemiology, and epidemiology is basically like you talking about the impact of this disease condition on the world. Okay, what this disease condition has done to several parts of the world and all that. We're talking about the etiology. Etiology is basically like the cause of this disease condition. They'll be talking about classification of schistosomiasis. We'll be talking about pathogenesis, all right, the steps through which this disease condition actually progress. We're talking about morphology. Morphology is basically you looking at the organism that causes this disease condition and looking at their body structure, how they are like. They'll be looking at the clinical features of this disease condition. We'll be looking at the possible treatments of this disease condition. We're talking about the clinical correlation. We're talking about the complications. Complications is basically like, okay, if this disease condition is left untreated, what will it result to? They'll be talking about prognosis. Prognosis is basically like, okay, the likelihood of someone who is affected by this disease condition to recover. Okay, so that's it about the course outline for pathology of schistosomiasis. Okay, subsequent lectures will be doing videos on each of those conditions, right? I have exactly 33 videos coming in on the pathology of schistosomiasis. All right, but maybe when you're watching this video, I've already done it, so you could just go to the description of this video. You see a playlist has been featured there. Click on that playlist and you see all the videos in that playlist are videos on what? Schistosomiasis, right? So that's it, and see you guys in the next tutorial. Bye for now.